And Eileen, you've sent out a note to all these folks about our various conferences, etc.
Yes, they should be receiving our newsletters, and another newsletter will go out next week with all of that information.
Right. So we have a conference coming up in April. We're organizing one in the fall on psychotherapy for adults with ASD. So we've got a lot of things going on. We have a book event coming up on site in a couple of weeks. So stuff is happening, and we're delighted to have you this morning. And we're also delighted to have Andy. Andy's from Autism Speaks. I'm going to let him get started and introduce himself. Andy, take it away.
Thank you so much, Fred. Obviously, I want to thank Fred and the center again for giving me this opportunity to chat with all of you this morning and to share with you a little bit in terms of what we're doing at Autism Speaks on the global front. And I want to thank all of you for taking the time this morning for joining me for this little conversation. What I hope that I can do in the next 45 minutes or so is to give you a sense of the work that we've been doing at Autism Speaks over the past decade plus a little bit. Um, and um, and I also hopefully impress upon you how our work, even though is done in a global setting, there are many issues that resonates also here in the United States, and that we indeed are bringing some lessons that we've learned globally back into the US as well. So let me share my screen. Hope everybody can see the screen. Okay, again, so I'm Andy Sherman, Chief Science Officer at Autism Speaks. And I've known Fred, I've been in the community for over 20 years now, and I was an early admirer of Fred and his team's work at Yale's Health Study Center. Really did some really early, some real groundbreaking research, some of which we're still obviously benefiting from today. And uh, this is the reason that and this is the reason that we're here today, right? To talk about what is happening on a global level. Just a reminder, that majority of our community actually live outside of high-income country. And high-income countries, that these are according to World Bank, right? So these are the country here you see on the screen that are in orange. North America, Western Europe, Australia, and Japan, and so on. But majority of our community actually live in countries outside of these countries where uh, typically the treatment gap is 90%, over 90%. So what does that mean? What that means is that 1 out of 10 autistic children or adults who need support and services are not getting it, right? So it occurred there's a great need. There's a global capacity shortage, be able to provide support and services to these individuals, and we need to find a sustainable way to deliver timely, effective autism services in various settings, especially in low resource settings. So Autism Speak Public Health Portfolio, is this is one of our priorities, where we aim to aspire to sustainable change through collaboration, data-driven advocacy. We see ourselves as in the middle of the community, policymaker, and researchers, and we contribute technical advisory, community data collection analysis, as well as models, tools, and technologies. And what we hope to do is that to be the go-between between community, policymaker, and research, so that we can benefit from the science that's been carried out, and to provide the evidence to help us advocate for policy change and system reform. So the vehicle in which we do this is a initiative out this called the Global Autism Public Health Initiative. This has been around for quite a while now, and over about 15 years to date, I think. And what we do is really to support local leaders to address local priorities using locally customized solution. And I will go into that a little bit more as the talk goes on. But I want to give you a general sense in terms of the area that we really touch on. There's 4 pillars to our work globally: is research, policy development, capacity building or training, and of course advocacy. I will go into depth on a few of these things, but I just want to go over a little bit about the research that we've supported over the years. So we were responsible for funding as well as providing technical support for the first prevalence study in Mexico, South Korea, China, and Qatar for example. And in Qatar, the study actually led to a development national action plan for the country. Um, we have also developed a family assessment tool that help us and help our government partners to better understand the needs of their community. And this tool has been deployed in various countries, including Serbia, Brazil, and Bulgaria. We have also developed a open source screening diagnostic tool. As many of you know, the gold standard tool, the ADI-ADOS, is very difficult to assess and in low resource setting. So we were very keen on trying to develop alternative solutions so that we can identify children as early as possible and get them the support and services that they need and deserve. And then, of course, we have supported a caregiver media intervention studied by Dr. Jonathan Green, for example, and others, Grace Baranek, and so on. And that really led us to a better understanding about how do we develop early intervention, even where in the communities where infrastructure and resources are wanting. Um, so what I plan to do for the rest of the talk is to really focus on three things that are interconnected. One is Global Report for Children and Development Disability that we collaborate on developing with WHO and UNICEF. I would spend a lot of time talking about the WHO caregiver skill training program, which is really our flagship initiative at this point to deliver on the promise of accessible, effective intervention and support services, no matter where you are, no matter where you live in the world. And the last but not least, I will talk to you a little bit about our Advocacy Leadership Network, which is really comprised of our leaders from the global advocacy community. But before I do that, just show you my team. These people combined have traveled millions of miles around the world, getting to learn the community, understand the community, and offer support that are needed. So they really are the people who had done bulk of the work that I'm going to share with you at this point. So the first project I want to share with you is the WHO Caregiver Skill Training Program. So what it aimed to do is to empower caregivers with skills they can use in daily routines to promote development with special emphasis on social communication, daily living skills, and positive behavior. To date, this program has been implemented in over 40 countries. We started developing this program in 2005, and what we aim to do is to develop something that can really support caregiver children ages 2 to 9 years of age who have developed delay or disability. We have a special focus on caregiver children with delays or impairment in social communication domains, right? And the reason we word so broadly because we recognize that, and indeed we don't require a diagnosis for assessing this program, is because we recognize that to get a diagnosis that we get here in the United States is probably very difficult in many places around the world. They just don't have the capacity and tools to do this kind of work. So what we really do is just try to say, if the parents are concerned or family members concerned about child development, then this is a program that could potentially help them. And the goal is really to increase caregiver skills, to promote their children development and well-being through joint engagement and play in home routine. And what do I mean by that? So structure and content of the program is there's group sessions in the community as well as home visit. The group sessions are ways in which we can efficiently teach the caregivers these evidence-based strategies in a setting. It also has the advantage of helping us form these community support groups, right? So we have the caregivers all having similar challenges. They come together to learn, and we do see this dynamic happening, developing in all these in these group sessions where caregivers start to help each other, help try to understand certain things, practice certain things, and so on and so forth. But we combine that with home visits, which are also important because when you go to the home, this is when the trainer, for example, are able to identify the family's priorities. What are the parents, caregivers' goal for the child, for example, and then so we can further customize the implementation strategy to help support those goals. But basically, within those 9 group sessions, 3 home visits, we try to cover some of the basic activities, such as engaging children in everyday activities and games, understanding their promotion, their children's communication, those including those who are minimally verbal, and that in turn is really about how to understand behavior and helping the child to show more positive behavior, right? And just as important, it's really about teaching skills to everyday life. And last but not least, and this is not available in many parent training program, which is really thinking about we have a module of caregiver well-being and problem solving, because we recognize that the caregiver are not doing well or are having challenges, their ability to support their loved ones is probably going to be compromised as well. Um, so furthermore, the content of the program, as I mentioned, had these basic strategies. So what is really comprised of the content? So what WHO and Autism Speak did is that we conducted extensive literature review, and and uh, um, and we try to identify elements that we call active ingredient from a variety of intervention models and across various intervention models there. So in the end, what we selected and highlighted is really the joint attention symbolic play. So really to focus on joint attention. That's developed Jasper intervention that's developed by Connie Costry at UCLA, and the pedal response treatment and behavior intervention that's developed in California as well, USC, the Kagos, and that provided us with both the strategy, the evidence-based strategies, as well as the age range, right, which we can potentially address, with this program. And the positive parenting approach for promoting positive child behavior management, challenging behavior. Some of that is more DT oriented, but largely is really naturalistic developmental behavior approach to do this intervention. So, and then finally, last but not least, we also promote caregiver problem solving and well-being. All right. So now, what we have done is, in addition to develop these courses, we have also during COVID, like everybody else, try to think about how do we continue to enable these services globally, even with these restrictions about getting together and so on and so forth. So we developed an e-learning version of the tool. It's really self-directed for caregivers, so it's like a self-paced learning tool. It is based entirely on has the same CIT skills and strategy as in the former program. It takes about 8 hours self-paced for a caregiver to go through it. And it supports low bandwidth, so it can be used as a just-in-time thing as well, and it's super suitable for mobile devices. And currently, it's being translated as well as tested in Arabic, Chinese, Spanish, Hindi, Marathi, Yoruba, and Portuguese. Yoruba, by the way, is in Nigeria. And what we have seen also is that in some of the sites that already have implemented programs using a combination of the old, more traditional pen and paper, format with the e-learning version, either as a preparation tool, as homework, or what have you, or reinforcement tool. So it's really finding a broad acceptance at this point. So this is what the implementation program looks like at the end of the last year. So we have implemented over 40 countries. The countries that are highlighted in blues these are sites where we have successful program established, we have demonstrated impact and benefit to the family, and government and as well as local funders have see the value, are now scaling up, meaning there's investing more sites, more access points for this program. And you can see quite a few countries are doing that, right? And I should just add China to that. They actually in the last year, the Ministry of Health decided to take out the program and make it available worldwide. And Autism Speak WHO over the past little less than a decade or so, I trained over 250 master trainers. And these are people who can train other trainers in their own respective territories. And in US too, we're also seeing, we're also starting to implement this program in US. as I mentioned earlier, a lot of the issues that we see in globally in low risk setting can also be found in the United States, right? Think rural area, things inner cities, for example, or think about community and where there where a minority community in the United States, for example. And so what we have done is to also take some of these versions, for example, that we have adapted in New York City. For example, we work with a community health clinic, and we made the Chinese and Spanish version of the tool available to the New York City community health clinics. That's an example of the way in which we're making this program accessible in the United States. Um, and the program really does work, right? And what we found is that, over the past, 6, 7 years we've been implementing the program. We've also been doing research along the same time. We want to make sure that uh, the intervention that we really are introducing to the community actually are able to deliver a meaningful result. So there have been numerous studies, dozens of studies been done so far, from feasibility field trial to RCTs, for example, in Italy and so on and so forth. What we generally found is that there's a high level of feasibility, right? So doesn't matter which community we're in, it could be in rural Ethiopia somewhere, or it could be in the city of Seoul in South Korea. The parents and service provider universally find the content and the program to be easily and feasible, and they can easily implement it in their respective communities. Um, and that we can see that the fidelity of the delivery of the intervention from these non-special facilitators, right, to the child is actually quite good, right, and very high, and that and the caregivers adherence to home practice is also very, very good. So all these tells us that this is a package that doesn't necessarily add to the burden of most caregivers, and actually provides a meaningful solution for them in their home and community setting. And and as I mentioned earlier, it can also be adapted for remote delivery, as we've shown in e-learning version. Indeed, during the COVID, we actually conducted a pilot in the U.S. With Easter Seal Midwest, when we did the training and the support through Zoom, and actually worked out well. We actually published on that as well. So what we found in all these research is that the package actually improved caregiver skill interaction with their loved ones, and that the caregiver believe that they're actually more able and therefore to meet the needs of their charge, and because that they feel less stress and just about work that they're doing. And what we're also seeing is that their impact on the child as well, right? Seeing that the children are initiating communication gesture, like pointing and so on and so forth. And then and we have a measure called the parent-child interaction. What we see is that the dialectic interaction between parent and child, or caregiver and child, seem to be also improving as well as the daily living skill of the children. So the goal for in the near future for this program in the U.S. and the rest of the world um, are similar, but are moving forward at a different pace. In the U.S., what we're trying to do, as I shown earlier, we started in some states in the city now, in the United States now. What we're trying to do is trying to incorporate this program in U.S. program systems, right? That are already supporting our families and our children. So Head Start program, we actually were talking to Boston Head Start and about how to adapt this program, for example, for classroom, right? This is a request we're getting quite a bit now. Parsley intervention, parent training centers, as well as HMO like Kaiser and so on and so forth. And the long-term goals eventually is that this program will hopefully be broadly accessible nationwide. We have a piece of legislation that was initiated by proposed by Representative Grace Meng from New York City, but now it's been taken over by a colleague, a Republican colleague in Congress as well. That basically is it's called American Family Caregiver Act. that will help support more caregiver training programs like the CST in the United States. Internationally, what we're hoping to do is to continue to increase the number of communities and countries that implement the program via broad multi-stakeholder collaboration. I will go into a little bit, give you an example of that in a minute. But then ultimately, what we want to do is to facilitate and enhance sustainability of these programs around the world, either through various innovation as well as online community of practice. So switching gear a little bit, I want to give you an example of how we're further disseminating, implementing this program in different contexts globally. And 2 years ago, Autism Speaks, UNICEF, and WHO collaborated to develop the global report on children with developmental disability. I want to say that this is the first report of its kind in WHO and UNICEF's history. There's previous report on children with disability, but certainly does not highlight the children with developmental disability such as autism and CP and so on and so forth. So this is really try to fill an important knowledge gap relative to autism and other developmental disabilities. And when the report aimed to accelerate changes toward enabling environments and responsive healthcare worldwide, and also to provide country government and stakeholders, with a framework of action. What do you do? What can you do to help enable progress and move forward? So it's really designed for decision makers, policy makers, and service planners in healthcare and other sectors, and various representatives, including those on youth and personal lived experiences. And some of the things that we're trying to think about in a larger context is really not only it's really the system that touches our autistic people as well as their family, and how does that contribute to challenges, lifelong challenges for individuals, and what are the opportunities for it to address them. So, for example, we know that social exclusion, with autistic people, stigma, poor quality care can lead to, chronic conditions like obesity and type 2 diabetes, right? We know that across the spectrum, autistic people tend to have higher risk for heart disease and diabetes, and so on and so forth, and respiratory disease, mental health conditions, so on and so forth. And some of that is really being contributed by, these lived experiences. And of course, ultimately, these complications, these additional, health burden will result in increased risk for avoidable, treatable, preventable mortality or premature death. There was a study that came out of Denmark in 2015 that actually demonstrate that on average, autistic individuals have a shorter life expectancy than their neurotypical counterpart by the range about 10 to 15 years. But there are things that we can do, right? And I highlighted those that Autism Speaks are already doing at this point. Everything from strengthening coordination, accountability at a system level, but also things like make sure that our members, our family, right, our community are actively engaged in policymaking and monitoring. So promoting participation, advocacy, leadership, policy, programming, and monitoring, making sure that the social determinants of health are being addressed. Social exclusion, for example, is a big one. Lack of health promotion, exercise, and so on are some example of some of the social determinants that may impact well-being and outcome that we're addressing, as well as other things like information and data research and so on and so forth. So these are all the things that the report recommend that we can do to improve the outcome of well-being outcome of individuals with developmental disability, including autism, around the world. So as an example, CST can be firmly placed into this context, development context, as a tool that will facilitate reaching of those goals that I've highlighted earlier. So this is an example of something we've been working on with UNICEF for the past 4 years or so. So they have an initiative called Care for Child Development Initiative. And the goal is to increase inclusive care pathway for children with developmental disability. What that means really is that in many countries, especially low resource community around the world, there is no clear pathway to care, right, for children with developmental disability or developmental differences. Um, in many places, what you see is that children with developmental disability are taken out of the mainstream in terms of care and education, and put in what they call, Department of Social Solidarity or Social Development, which of course, they is not at all integrated into the community, and an opportunity for assessing quality care support is minimal. So the idea here with UNICEF is really how do we develop these pathways to care that are inclusive, right? And that so that our children and loved ones can continue to benefit from the best possible support during development. So the idea is to try to implement this step care model in 3 countries, and the one they selected was Bulgaria, Uganda, and Peru. What we did is that we provided training for TST for the government professional in these countries, right? And in this pilot, and they position CST at tier 2, right? And tier 2 intervention. The idea is that if tier 1 intervention for child development is like, environment, enrichment, so on and so forth, safety, tier 2 is really about, additional support for social communication and so on and so forth. And then there'll be tier 3 that are more condition specific, autism, CP, and so on and so forth. So we did all the training for tier 2 that really targeting social communication development and positive behavior. Pilot was extremely successful, right? And the country is so pleased that and all 3 of them are in the process of scaling up these pathways nationwide. Okay, switching gears a little bit, I'd like to talk about the people behind all the progress that made. I shared with you, our small but mighty team in the early part of the talk, but really have the real reason that we've been able to make so much progress in the past 10, 15 years because of our families around the world, advocates. And I really had the honor and privilege over 10 plus years traveling around the world to meet some really incredible people that we're able to learn from and to work with and so on and so forth. And informally over time, we're able to put them together into a network. And so these are all accomplished international leaders. They are self-advocates, family members, professionals, and policymakers. And we stay in touch, right? If you go to my Facebook page, for example, vast majority of them are family members and advocates from around the world. So we keep in touch through real-time social media, and we also get together in person, right? Every 2 years, where we do exchange knowledge and share latest news, as well as develop collaborations. We usually focus on advocacy and dissemination of knowledge and solutions, and implementation and research regarding programs and so on. So some of the high impact collaboration that we have enjoyed to date is this network supported UN World Health Assembly resolution on autism, and about half of the global sites that I've shown you earlier for CST were really enabled by these advocates, right? What they did, they went to their minister of health, and their government say, we need this program in our country, please bring it in. So very effective that way. And they also contributed their lived experiences as well as other informations and data to the global report for children with disability. So here's a sense of what they look like. We started this in 2010. Some of you may know Bob and Suzanne right here in the middle here. They're the co-founder of Autism Speaks. As you can see, when we started in 2010, it was fairly small, right? We had maybe a handful of countries here, but it was a inspiring meeting, and I think we all went away from there committed to do more. So by the time we were 2016, Washington, D.C., the membership had grown, really much more significantly. In addition to the old friends that we had in 2010, Over the 6 years, 3 meetings or so, we have, included many other friends. I think, we have about 80 countries engaged in the network at that point. Because of the size of these networks, started to repurpose some of the meeting and started to do more of the regionally focused efforts as well. So we work with the Chinese government and worked with the Chinese government back in 2018, where we brought the Advocacy Leadership Network and the CST technical meeting to China, and we're able to really have the community actively engage with us as we talk about the next phase of development for the program. And then finally, this happened right before the pandemic. This was back in January, early February of 2020. We had a meeting in Addis Ababa, Ethiopia, a regional meeting like the one we had in China. We use this meeting actually as a planning meeting also for the World Report on Development Disability that I mentioned earlier. So you see on the banner on the right, it says technical consultation. So we had representatives from, I think, about a dozen sub-Saharan African countries here at the meeting. It was, again, very productive conversation. And then finally, after long COVID, we had a meeting back. Again, we got together 2 years ago in Lion City. It's wonderful. And with a tinge of sadness, we lost some members during the pandemic. But I think the rest of us are more committed than ever to honor their memory by moving aggressively forward to continue the work that we started. And so in 2023, these were the countries that represented at the network meeting. It was really a very joyous and inspirational occasion, and the group reconfirmed their commitment to the network. And what they're actually working on right now is an advocacy training package that are developed by and for autistic adults globally, right? So these are international self-advocates as well as parent advocates coming together to develop an advocacy training package for individuals as well as their loved ones. We're planning to reach an African research consortium with Peter de Vries in University of Cape Town. And we're going to start with quarterly webinar. And once again, we're looking forward to a meeting later this year of the Advocacy Leadership Network. We actually have more members now. For example, Mongolia, Cote d'Ivoire had just joined. We're looking forward to meeting new friends as well as visiting with old friends later this year. So that's it. This is actually one of my favorite pictures. This was taken in Sao Paulo about 10 years ago. And these are a bunch of autistic adults, young people at a center who put on a wonderful dance show for us. And to me, this picture really captured the vitality and the hope and aspiration of our global community. Thank you very much.
Fred, you're unmute. You're muted. Fred, you're still muted.
How about that?
There you go.
Okay, third time's a charm. Thank you very much, Annie. This is a great talk. We're going to have some questions from the audience. I had two questions that maybe you can talk a little bit about. And I know this is an interesting and complicated topic, and I really applaud your efforts and all the progress that's been made. One of the things some years ago, I had a chance to meet with UN ambassadors in Africa about autism services. And the thing that struck me was in some funny way, the system of care was sort of modeled on the US system in the sense of there was a kind of a diagnostic aspect and there was a service aspect, and they were divergent. And as in the US, often it's physicians and psychologists who make a diagnosis, but then it's actually teachers that implement, along with parents, a lot of services. Is
Right.
that kind of dichotomy reflected internationally?
No, I think that's, we don't see that economy internationally, right? And most of the time, the intervention is implemented, well, in community where there's more of a healthcare infrastructure by health professionals rather than education professionals. Education professionals are rarely involved in the implementation of services or treatment. And and then, of course, for those family with resources, they will engage, private sector therapists and so on and so forth, few and far between. Otherwise, it's really a program like these, right? Like the family training program.
Yeah.
Michael Powers, his program that he's been advocating globally as well. Those are the ones that's really been the solutions for most of
Yeah, it was interesting because many of these ambassadors had either children or relatives, and they sent them off to other countries, usually the UK,
yeah.
for treatment because there were so few services available. The other thing I was just going to ask from my own point of view, one of the things that I've been interested recently is the uses and failings of the diagnostic systems. And one of the problems that has sort of come up, and you can even see it in the US, things like the DSM, there are issues, and some of the screening instruments as well. There are, and God knows the diagnostic instruments, which go back to the DSM. So it's a complicated, dog chasing its tail.
Yeah.
Uh, Issues of not only gender bias, but cultural bias. So issues of underdiagnosis in some populations, overdiagnosis. As I recall, David Mandel did some work with Hispanic populations. I think maybe with the MCHAT, looking at there was a tendency for over responding on the part of parents, so that there are some cultural issues that it seems you've been trying to work around. But I wondered how much, to what extent you've been aware of this as a problem.
Yeah, thank you, Fred. Yeah, I mean that is a major issue, right, for development in the international community, an assessment tool. So what we've been trying to do is actually three things. One is, we've been trying to do the adaptation, translation of ADI-ADOS, where possible, and so on and so forth. Other thing we try to do is to uh, is trying to create a set of tools that can help us identify children at risk, but maybe not necessarily autistic per se, right? Because we're not sure what is the value of having that label in an environment where services are few and far
Yeah.
between, right? So, but identifying a children who need support, I think is really the primary aim. So we are developing tools, right? So, for example, one thing we published 2 years ago, we had an opportunity. So World Bank was doing a survey in Nigeria, national household survey in Nigeria. And what we're able to do through some contact in World Bank was insert 20 questions in that household survey, asking about development status of the child, right? And we're able to get so this is population wide, the whole country. We're able to get the data back. And then we did analysis of the questions, and we developed a population-based tool, right? That has good properties, psychometric property, that seem to identify children at risk for autism. So I think, that's one way I think we can try to, think about how do we enhance identification of children as early as possible, right? Have some standardization around it without having, to rely on the tools that are developed, outside of their country and culture necessarily.
That's good. That's great. Eileen, do we have any questions from the audience?
Not at this time. If anybody has any questions, please place them in the chat and we'll get to them immediately.
I could keep asking questions. I'm full of questions and chance to discuss with Andy the whole package of issues around obstacles to service and lack of awareness, lack of training. And I was really heartened to hear how much work you put into training some of the professionals in these other countries, because it's been interesting for me because I see a lot of folks from very different disciplines, very diverse backgrounds, and
Yeah,
widely and wildly
yeah.
divergent training in the area of autism. And how much, as part of this whole package, do you see the training piece as being really set in terms of raising awareness and having people provide and being aware of evidence-based services as opposed to, you know, some of the wackier stuff that's out there, which does, it's not been shown to do any good.
Yeah, I think that's actually key, right? Because so the reason we ended up doing caregiver training is because we tried the other way. We tried to train professional and paraprofessional in low resource community. You know, for example, we're responsible for putting together the first homegrown ABA therapists in Saudi Arabia. Um, but the problem is that in most of these countries, and this is not a judgment on anyone. I mean, I would totally do the same thing. Many of these professionals, when they have acquired these extra skills, they either immediately go into private practice or they leave the country, right?
Yeah,
The community is still left without that expertise and that service. So in the end, we realize that the only people that can't leave are the caregivers,
mm,
right? And so that's the human resource we decided was important for us to tap into. Um, so I think in many ways, you know, the way we think about developing services in community is that especially when where there's no specialists, in order to meet the challenge in the near term, you have to leverage existing human resources. And that's usually in the form of community health workers and caregivers and so on and so forth, right? And you see that not just in autism, right? You see that in
yeah,
psychiatry in general, depression, you know, so on and so forth. I mean, this whole caregiver training program is really, you know, more of a kind of a task shifting, task sharing strategy that's used in, you know, public health. So
yeah. Any questions come in, Eileen?
Nope, no questions at
Much
this time.
you've wowed them. This has been a great chance to talk and hear about your work and hear about
thank
how
you,
everything's
Fred.
going with Autism Speaks. And, you know, it's really gratifying to see the amount of work that's going on and the extent to which you really push things outside of the US sort of Western culture bubble. And it's just amazing to see the amount of work that's gotten done. It's fantastic. So thank you very much.
You're very kind.
We'll have this online at some point soon so people can come back and look at it. And
Okay.
I wanted to just underscore the report that you guys were involved with. Do you want to just highlight how people get to that? Is it online?
Yes, it is online, and I'm happy to let me I can pull the link for you.
That'd be great.
Okay.
Because people may be interested in looking at that report. It's interesting because some of the things I've been aware of at the international level is there have been sometimes conflicting, I don't want to say conflicting, it's people have been working in their own silos. So you have the UN and UNESCO, you have the WHO, and then you have some private foundations, and they're all kind
Exactly.
of plugging away, not necessarily in coordination with each other.
No, exactly. And you know, I mean, the other reason we really decided to partner with WHO is because, you know, in many of these countries, you know, that's where their health department and education
Yeah,
get their guidance from, right? So that's really the right channel for us to disseminate, you know, the strategies and the policies.
yeah. If you can either send us the link or if you can show it,
Yeah,
people,
I sent the okay.
fantastic. So we'll
Let me
circulate
I
that.
can show you I can share with you the
So we do have one question now in the talk in the chat.
okay.
It just says, "Great talk and initiative. Thank you. As a Brazilian, I'm happy to hear that Brazil is part of this program. I was wondering if the training is offered in partnership with the Brazilian public health system."
Yeah, thank you for that question. Actually, Brazil is one of our great success stories, right? We started the project with a uh, community advocacy group, a foundation called the ICO Project. It's based in Curitiba, and so we did the initial pilot for CST in Curitiba with support of the government, city government, and it was very successful. And the Ministry of Health saw the outcome and we published, you know, the outcome. The Ministry of Health was so pleased with the outcome that they're now scaling up the program nationally.
That's great. Any other questions? If not, Andy, thank you very much. This is a great talk, and
Thank
it's
you,
a
Fred.
great way to be aware of autism during Autism Awareness Month.
Indeed. Thank you so much, Fred. Have a
Thank
great
you.
weekend,
Thanks,
everybody.
everybody, for attending.
Take care. Bye-bye.